All right, thank you, Senator Cassidy. Mr. Chairman, I want to submit for the record first is an op-ed in the Washington Post, April 11th, 2002, by a Democrat senator from the great state of Indiana, Senator Bertagnolli, and of course, one of my boyhood heroes, the late great Senator Bob Dole from the state of Kansas. And it's an op-ed about the Bayh-Dole Act. And I'm sure, Dr. Bertagnolli, you're familiar with this, that this entices the private practice to seek public-private research collaboration rather than focusing on its own proprietary research. If confirmed, will you commit today to uphold the integrity and intent of Bayh-Dole?
Thank you, Senator. And if confirmed, I will commit to uphold the integrity of the Bayh-Dole Act.
Thank you. Next, I want to talk about research. In 2022, nearly half of all NIH funding went to institutes in just 5 states, and they happen to all be on the coast. I think that when we center all that research in 1 or 2 geographical locations, you have incest, you have a decreased randomness of thought, and it pickles things up. The University of Kansas Cancer Center, second to none, NCI designated comprehensive cancer center since 2012. The Kansas State University received NIH funding in 21 to support it becoming a national leader in emerging infections. Children's Mercy Research Institute in Kansas City, advancing the genomic medicine, developmental behavioral health, and pediatric brain cancer research. Will you commit to actually correcting these issues so innovative research in the Midwest are equally prioritized?
Thank you, Senator. And not only will I commit, I can give you an example of where my past work has really already tried to achieve this. When I ran a cancer clinical trials group, one of my main goals was to make sure those trials reached as many communities as we possibly could. And we partnered with a wonderful physician practice in Laredo, Texas, serving the border community, a wonderful physician who served the Ogallala Sioux community at Pine Ridge Indian Reservation, and a wonderful oncologist in my own hometown of Rock Springs, Wyoming. So I agree with you completely. NIH research has to reach everywhere, and there are many, many centers of great excellence that we should have the ability to engage.
Okay, well, my next question is a lot tougher one. And Dr. Bertagnolli, you and I both protect a very honored profession. And when I think about the horrors of medicine, the great horrors of medicine, the things we got wrong, you think of bloodletting. I'm afraid that 100 or 200 years from now, those same historians are going to go back and compare irreversible mutilation of adolescents for transgender surgery, irreversible emphasizing, and giving them irreversible medication is going to be one of those 2 horrors that they're going to be talking about. They're going to be talking about bloodletting and the horrification of disfiguring surgery for people that 80% of them just in a couple more years, once they have some hormones of their own, are going to say, maybe that wasn't a good idea. And before you answer this question, I want you to think about the oath that you and I took. And it's way overquoted, but it's above all, do no harm. Above all, do no harm. So here's my question. Should taxpayers fund gender reassignment experiments or research that are purely cosmetic, where you destroy healthy tissue and organs, or when they use FDA-approved products off-label with significant negative irreversible impacts? Again, this off-label use isn't treating diseases or illnesses. Should taxpayer funds be used to do research or fund these irreversible, horrifying, irreversible procedures and the use of these hormones off-label?
So, Senator, thank you very much, because it's very clear that you share my concern over the well-being of the LGBTQ community, especially young, vulnerable people. What I can tell you is that if confirmed, I will commit to leading NIH to conduct the research that will achieve the very best health for these vulnerable and special individuals.
Sorry to cut you off, but right there, do you believe that it's okay to fund this type of research where these irreversible procedures are being done? Do you think there's any experiment that you can think would justify irreversibly damaging these poor little boys and girls who are 14, 15 years old. Will you fund that type of research?
Any research that we do, Senator, with regard to human subjects has to be done in a way that does no harm and produces the maximum benefit to the people that are participating in the research. And that will be the principle with which I approach any research, especially for this vulnerable population.
Thank you. I yield back.